In recent years, I've had countless conversations with Montana seniors. Almost without fail, after they've shown me pictures of their grandkids, the topic turns to health care. I've noticed a growing anxiety among older Americans who are more likely to need health care services for critical care. Concerns like, how will I pay for my doctor's visit? Will Medicare go bankrupt, and if it does, what does that mean for me? How can I afford my medication? What if I can't get to my doctor's office, or if my doctor is too busy to see me immediately? What happens if my doctor stops accepting Medicare? These concerns reveal a simple fact. Our healthcare system is broken, and it needs to be fixed. Seniors know that Medicare is in trouble. Healthcare costs are out of control, and more people become eligible for Medicare every day. Unless we make a change, there's just not enough money. For the sake of our seniors, who spent a lifetime earning their benefits, there are real reasons to worry. But one thing Montanan seniors shouldn't worry about is where I stand. I'll never vote for any plan that undermines Medicare. In fact, right now, some opportunistic politicians, including a few from my own party, are using political spin to try and scare seniors. So let's cut through the spin. Here are the cold, hard facts. There have been two recent efforts to change Medicare as we know it. The recently passed health care law, which some call Obamacare, and the Ryan budget. Although both were well-intentioned, if implemented, both could end up hurting more than they help. I voted against both of them. And in fact, I'm the only one in the Montana congressional delegation who can say that. Because it's the current law, the new health care law poses the most serious threat to Montana seniors who rely on Medicare. Most seniors already oppose it without realizing the 2,500-page law includes the largest cuts to Medicare in history. More than $500 billion according to both the Nonpartisan Congressional Budget Office and the Nonpartisan Centers for Medicare and Medicaid Services Actuary. Let me say that again. President Obama's health care law cuts Medicare by $500 billion. This includes $132 billion in cuts to gut Medicare Advantage, a program that provides health insurance for more than 24,000 seniors in Montana. At the same time, the health care law slashes payments to doctors and health care providers. As a result of these cuts, many doctors and hospitals will simply have to stop seeing Medicare patients altogether. That will mean longer waits and rationing. These are just a few of the reasons I voted against the health care law, and it's just a small part of why it's so important to repeal it now before it's fully implemented and causes irreversible damage to our health care system. The problem with the health care law is that it was motivated by the urgency for health care reform that most Americans feel. But it was written by powerful special interest groups behind closed doors in Washington, D.C. The same top-down, Washington-knows-best approach led me to stand up to my own party and vote against the Ryan budget earlier this year. While I fully support Congressman Ryan's plan to reduce out-of-control spending, his plan to reform Medicare was a product of Washington, D.C., not the American people. Neither the Obama health care law nor the Ryan plan makes sense. So what do? This is America, and we can overcome any challenge if we remember the source of our greatness. Government of the people, by the people, and for the people draws its strength from the unbound genius of the people. Why, then, haven't we looked to the people for solutions? Consensus is built from the bottom up, yet lately in Washington, it has developed into a habit of crafting legislation in secret, and they're presenting it to the public as a finished project. Take it or leave it. A better approach is an open and transparent process that includes the public from the start. Montana's seniors ought to have a say in the changes that impact their lives. So should families, small business owners, students, and everyone else. In a democracy, that's sort of the whole point, and it works. After more than 80 listening sessions throughout Montana, I've heard from thousands of Montanans. The ideas I hear from real people usually make a whole lot more sense than the nonsense that comes out of Washington. Montanans can take this to the bank. Any Medicare reform I support must first have your support, especially Montana's seniors.